this episode of COVID and mental health with Grab a Cup of Tea.
Hi, this is Vino, and I'm really grateful and honored to have a very special guest, Nadi. I'll let her introduce herself, but to me, she's a very close friend. We actually went to school together in Sri Lanka. She studied with my sister, Susan, so shout out to Susan as well. We had a lot of great time when we were a kid, and to be reflective of this time, we wanted to make a difference. And to have Nadi as a clinical psychologist come and speak today is a big honor to me. So Nadi, do you want to go ahead and just introduce yourself?
Sure. So I'm Nadi Paranamana. I'm a clinical psychologist in training, actually. So doctoral candidate in clinical psychology at the University of Hartford. Currently engaging in dissertation and a lot of research and other advocacy related stuff in the field. I just wanted to say that the views are my own and do not represent any organizations that I'm affiliated with. So take it from me.
Thank you so much, Nadi. So we all know that COVID has been quite a difficult thing to deal with. But one thing that I would like to hear from and get you to address is, how has COVID impacted mental health? Has there been a rise in mental health because of this crisis? Because lots of people think, no, there is no relation. So why don't we start out there, Nadi?
Sure. So I've been reflecting on this a lot myself, just like hearing about different experiences from different people who have different relationships with me on a daily basis has been really insightful for me to kind of like, pull back and reflect on the grand scheme of things. So I think I'll start from there. As we all know, this is like a layered issue, right? So when we think about it psychologically, there's that first hit of like, COVID and the awareness that a pandemic has been set off, which created unprecedented changes and so much disarray in our minds as well as in the systems that we are part of, right? So that in itself now triggers a lot of stress and anxiety maybe in people and also discomfort. So recently I was reflecting a lot more on like what's been happening, because now we are almost like an year or a little more than an year into this discussion, and I think we can look at it in several different ways, but I'm going to talk about cognitive flexibility. So cognitive flexibility is defined as one's ability to take different perspectives or hold different perspectives at the same time, right? And one of the researchers named Mehmet Bilkin, wait, I want to make sure I give the right information. Mehmet Belgin, he published a paper in 2009 where he conceptualized cognitive flexibility to be the intersection between adaptability, awareness, and confidence. So when these three components are there, a person is able to become cognitively flexible and make appropriate decisions and take appropriate actions, right? So if you kind of apply this to COVID-19, to begin with, awareness was limited, right? There was a lot of speculation and confusion about, the information that was going around. And we also knew that adapting to changes were necessary, but we didn't know what kind of changes we needed to adapt to, right? And of course, there was uncertainty that comes with it. And then the confidence. I mean, starting from your immediate family, the people that you trust the most, maybe, to the various, governmental, private organizations, to your, country's administrations. There was no single entity that could give you that confidence. We got this, we know what we are doing, don't worry, we are going to handle, like, I mean, people did state that in various ways, but I'm not too sure how convincing all that messaging was, at least in the early stages of the pandemic, right? So you see these three components of adaptability, awareness, and confidence are now compromised. So then we look at people in this kind of like a operating in this gray area and going through a lot of confusion. So are we surprised if this is what kind of like, if these three things are what informs cognitive flexibility? Are we surprised now about how people are responding to this situation? So we would think about, especially about the amount of misinformation and the conspiracy theories that have sprung up. So perhaps this speaks to some disarray in the cognitive flexibility field, right? So don't quote me because I'm not presenting empirical research-based, data here. I'm just like kind of like conceptualizing what may have been going on for us collectively as humans. And of course, so thinking about mental health needs of people, I have seen a rise in the needs as well as an increase in the intensity of mental health difficulties. And this again could happen for a variety of reasons, like, largely speaking, employment related, lack of childcare, logistical, financial, relationship related, budget cuts, right, which affect the individual at the end of the day, digital learning. I mean, we can go on and on, I think, but I guess I'll end from there because we'll be here all day.
You've described so many factors. The other one that most people are experiencing and is having a great impact is the isolation that most people are experiencing. So how about that? Can you address that for us too?
Yes, absolutely. So it's been interesting because isolation again is not like a standalone experience, right? People can become or like feel isolation at different layers. And so you might find a family of 6 spending 24/7 together while certain members of that family are feeling extreme isolation. And if this is like, for example, a kid or a young adult, the parents may not understand what is going on because, hey, we are all here, like what's going on? But I think it's this situation that has opened up for all of us gives an incredible opportunity for us to be more open about subjective experiences that we have as human beings, right? So, and it also speaks to the inability to generalize a lot of things, psychologically speaking, a lot of times. So I have seen isolation in the elderly community a lot. Even my neighbors, some of them who live alone with managed care, now are not able to have their assistant come home because of COVID, and they have to stretch and be flexible and try to do things on their own. So their families might visit, but then sometimes if they're immunocompromised, those visits will be limited. And of course, like kids and young people to report different types of isolation just because we can't socialize the way we used to.
Yeah, thanks, Nadi. How would you kind of define a little bit on mental health, how it affects adults, how it affects adolescents, and how it affects kids, especially during this time?
Yeah, so I'll start with kids. Um, Actually, I'll start with toddlers. So I've been talking to colleagues, who are working from home. And as difficult as it is with like childcare needs and, demands of their day jobs and stuff like that, they have offered the perspective of being really grateful to spend this extended amount of time with their kids in formative years, which is very interesting, right? So I would be super interested to read research 20 years down the line to see if these kids who were born into the pandemic or kind of like, adjacent years, if their styles of relating to other human beings is going to be different, or, or changed in certain ways than what we know. When it comes to like school age kids, like elementary, middle school, high school, I think again, it's a layered experience. Elementary, I have friends, kids who are having a ball at home, just doing like home projects and FaceTiming with their friends, because that itself is a new experience for the elementary age children. And of course, a lot of kids are also struggling with lack of structure. So when I say lack of structure, we are talking about a changed structure rather, right? Because they have digital learning going on. A lot of kids are still in that adjustment period. So we know this about learning curves, right? Learning curves can be steep or they can be kind of like gradual. And school is a gradual learning curve experience, but right now we have this opportunity where we have to like wake up one day and say, no, we are schooling from home, right? So imagine how that is like for the kids and the various amounts of stresses and also mental demands that it presents to the kid to be flexible. And when it comes to kids and cognitive flexibility, so cognitive flexibility is an executive function in your psychological functioning, and it's still developing in kids. So we are demanding for them to be able to do something that a fully grown adult would be able to do, and that creates its own kind of stresses.
You have so eloquently described the differences, not only within age groups, within the specific age group and everything else. Can you give us a little glimpse into what some red flags or worrisome things might be that we need to pay attention to more?
Sure. So I think one of the challenges of these times, especially if families are, spending time together, is this idea of needing personal space and needing private time versus where does that intersect with a mental health need, right? So if you're a family of 5 and you see your kids spending a lot of time in their bedrooms, doing their thing, one might think, okay, they just, need their personal space, but it might not. So I think there are other like signs and symptoms that you can watch out for. So one thing is, are there like changes in sleeping patterns? Do they spend a lot of time sleeping or awake? And then are there changes in food intake, right? But this one is again tricky because we know when the pandemic started, there were so many jokes, playing around about how many times we make a trip to the fridge. So, but I'm talking more broadly. So if there are drastic differences in these things, right? Food intake, sleep, even mood. You could monitor your family members' moods to see if it's like a prolonged mood difference or whether they vary. And even if they vary, are there like drastic changes? Is a person like, happy go lucky, and then the next half an hour is that person so sad and down, and in another hour is that person happy go lucky again without external events prompting that, a natural mood change. Other things also could be like, do they not socialize as much as they used to? And I think a good component of these things can be recognized if you have like the necessary conversations in the house, because you really want to understand why people are doing what they're doing and not really generalize or panic, right? So I think it's extremely important for families and people who live together to share really openly, like be honest about your own struggles and challenges so that it also normalizes other people's experiences and opens a space for dialogue.
You did.
Yeah.
Sorry, Pina.
No. Thank you, Nadi. And there was something else I just want to continue on that line or that
Mhm.
trend of thought is when you notice stuff like this, what do you do? Because, as a physician, if I notice something physically wrong with my child, I know what to do. Should I take them out? Or what would be some of your advice during this trying time where, you can't go out that much and stuff like that? What would be your advice there?
Sure. So if there is a mental health provider or a professional that's known to your family, that's the first person to talk to. There are also free like calling and messaging services, and I think Vino is gonna put those numbers out for the viewers at a later time. So definitely reach out to them. I mean, we know for any emergency, 911 or a visit to the ER is what needs to happen. But other than that, there are also specific support groups. So suicide hotlines, or if the issue is related to alcohol, different support groups that people may reach out to. And also there are also online like groups that are being offered. Some of them are free and some are not, so it's a really great idea to kind of seek out that information as well. But for someone who's struggling, you really need to talk to a professional.
Katie, you had a question.
My question was, you had spoken of the necessary conversations, and then if there's some way for you can help us to differentiate necessary conversations and then boundaries around what's too much for exposure for particularly kids, whether it be conversations between parents or what they can see news and such.
Right, this is a brilliant question. I've also been thinking about what COVID has kind of implicitly introduced to our mindsets, right? So we are always thinking about being careful, danger, death, becoming really sick, infecting others. And psychologically, what this does is to tell a person's mindset that, okay, there's some kind of danger out there, right? Every single time, like washing hands, touching the door handle, like everything is now kind of presented as a danger. So this sends that implicit message to the psychologically that you need to stand by because there's this danger. So fight, flight, or freeze. This activates the sympathetic nervous system, basically, and it may happen gradually over time. Um, so I think specifically for kids, breaking it down to them in a way or in a language capacity that they're able to understand things. I saw recently, I mean, they were trying to do this cool thing where they drew a monster and showed that if you don't wash hands, the monster will like eat you. I'm not sure, that kind of mass advertisements, I don't know if that's going to be effective because you're kind of instilling more fear into the child, right? I understand the reasoning, kind of like you want everyone to do it, but so positive reinforcements, if the child is acting in a socially responsible way, without you prompting, if the child is washing hands, compliment that and talk about what a good citizen he or she is, and how this is going to help everyone around because you're doing something to contain the virus.
Thank you so much, Nadi. This was really helpful. We enjoyed this a little conversation with you. Mental health is definitely something that we all face, right? And so we definitely hope to have more conversations around this. We together want to expand on this. So our hope is to continue a few more conversations, do a series on this. So definitely looking forward to that. And we will put some numbers down. So if you ever need, feel free to reach out to someone and talk. I think that's really important. May it be someone you trust, may it be someone within a close proximity, like a church leader or a community leader. Definitely speak out. Don't ever feel no one's out there. I think that's really important. I hope this episode was really helpful. Subscribe to our channel, and if you have any comments or questions, please feel to reach out to us. Thank you for joining us. Thank you.
Thank you, Rino. Thanks for having me.